Today's class, we want to work on giving ourselves repetitions of the rotational details, the side bending details, and the elongation details from lying on your back to side lying to low and high oblique sit up onto all fours. So when we're on our back, we've got our support points, sacrum, shoulder blades, head, and then we're reaching down with our shoulder blades, our sacrum, and our head for support, and then we're reaching up with our elbows over our knees. Arms aren't going anywhere. We're not dislocating our arms. We're not pulling our shoulder blades up. We're just trying to elongate the muscles by reaching with the elbows and helping control the muscles that create that uprighting of your spine and aligning of the shoulders, the ribs, and the pelvis, so it's easier to breathe in and fill that abdominal cylinder. And then when the abdominal cylinder is full and we're breathing in and out and stabilizing, we're bringing our limbs up. And in this position, we still want to maintain that cylinder and control it while we move. So we're pushing down with our shoulder blades, our head, our sacrum. We're reaching up with our elbows and our fingers just to activate those muscles. We're also kind of pushing apart into an imaginary support. Sometimes we'll use a band, but that just helps us turn on more muscles that connects the upper limb to the trunk, the lower limb to the trunk by reaching up with our toes and our knees as we push our sacrum down and we push our knees apart. So that same idea, we're going to turn our head to one side and roll onto that side. Come right over to our side. We can do the open and close, flexion, extension, and then roll our trunk over our downside, shoulder and arm, and hip and thigh. But we want to make sure that we're doing the same thing that we just did on the back. So we want to push down like we're pushing apart. We want to push our knee and elbow into the floor, pushing away, but it's helping us flatten and align shoulders, ribs, pelvis, so it's easy to breathe in and fill that cylinder, and then spread so we're not sagging. So we're aligned from a front to back perspective and a side to side perspective. So not sagging, so that outward push takes the sag away, push back helps us flatten and elongate, breathe in and fill. And that's where we want to rotate our trunk on our downside, hip and pelvis, shoulder blade and arm, and our motion should be at the arm as it comes into the shoulder blade, at our hip as it comes into the pelvis. And we should be able to feel kind of reaching back with the rotation of our trunk over that downside arm and thigh. And then from this position, we want to roll forward up into lower oblique sit, push ourselves away, take the sag out, push ourselves back with our elbow and our knee and thigh. So we flatten out our trunk so we're stacked and align side to side. Breathe in and fill. This top leg can relax. And again, we want to keep that stacked position and the flattened position side to side, front to back, as we rotate our pelvis over our downside hip, thigh, and have the pelvis rotation control our ribs and our shoulders. So we don't want to rotate just a little bit at the pelvis and over rotate with our ribs and arms. We want to control our rotation at the hip pelvis. And we do that better by kind of hinging forward a little bit, bringing our weight onto our thigh so that the more weight's on our thigh, the more we can push down and activate and control from the hips. So a challenging exercise from this point would be lean forward. Again, bring those elbows and knees over top the downside arm and leg and do an open and close top side and bottom side. Then we come back down and then weights over this thigh, push down with the thigh and the arm, come up into a high oblique sit. And then again, straighten ourselves up from a front to back and a side to side. Breathe in and fill. Hinge forward, get our weight on our front thighs so that we can control the hip and pelvis. And again, do some rotations there. Pelvis on downside hip. And we want this arm to stay static. And we want our trunk at the arm and shoulder blade joint to rotate a bit there. Careful not to sag, careful not to flare those ribs. Breathe in and fill to keep that alignment stable between the pelvis and the ribs. Hinge forward at the hip, push down, breathe in and fill, get some rotations, and then come forward a little bit more, weight on here. Now with your arms straight, you can do some open and closes from here, and from here you can go towards being in a quadruped position, all fours. So bring yourself down and then bring yourself back and control that movement forwards and backwards. Thinking about your stacking pelvis, ribs, and shoulders, and the spreading apart of your shoulders and your hips, and the reaching of your arms and legs so that it helps you with the stack and the side bending control. Good. From this position, you can also come up to all fours, be in a bear position, lift one arm and the opposite leg, and rotate down into oblique sit. And you can play with that as well. And again, that whole motion, try to keep your trunk stacked, pelvis, ribs, shoulders, and no side bending. So don't start sagging here. Keep yourself together and come down onto the hip and pelvis with your trunk stacked and aligned from side to side. Good.